there are various vaccines now coming forward, and they are nearing completion. So I think firstly, uh, the time zone where we are looking at is probably February or March, where we can have this vaccine. So next question is whether this is going to be highly efficacious. So efficacy wise, different vaccines are showing different efficacies, but all the vaccines, fortunately, are showing a efficacy close to 90%. So once inoculated, wherever these vaccines are inoculated, the 90% of the patients will show immune response, or which means that the COVID gravity, the disease of the COVID in those patients is going to be mitigated. So these vaccines are usually the mRNA vaccines. Now, how the mRNA vaccines is prepared, a specific sequence of a viral mRNA is taken, and the mRNA is actually made outside, and then the vaccine is created. That mRNA sequence will be inoculated into the patients, where the mRNA will combine into the host genomic material, and they form a specific proteins, the antibodies, to neutralize the COVID antigens. So this is how this vaccine is going to be function. The other kind of vaccine is an attenuated vaccine, where the virus itself is attenuated. So virus is isolated, it's attenuated. Attenuated means the virus will be inoculated, but that inoculation of a virus into a patient will not or cannot lead to a disease, but it will lead to an immune response. So this is the attenuation. So Oxford or AstraZeneca in combination is forming this live attenuated vaccines. And fortunately, we are lucky that this vaccine is being created in collaboration with the Serum Institute, Pune. So why I say so? Because once this vaccine is floated, it's functional, for the commercial use. We as Indians have certain prerogatives. We will be kind of, you know, having a priority of getting these a specific number of these vaccines for Indian population. So rather than waiting for US or European vaccines to come into India, so if the vaccine has some collaboration in India, so we are getting a priority out of it. So this is where I think the best vaccine we are looking at is Oxford and Serum Institute Pune collaboration vaccine, which is the attenuated vaccine. And I suppose it's not very far now. It's not very far. Probably they are claiming that they have done all the studies, and efficacy wise they have checked. They have done the dosing schedules. This is very important. So the dosing they are looking at is that it will require two dosages. The first dosage will be half the dose, and the second after a month, which has to be given after a month, will be full dose. So this is also a good in a way that more people can be inoculated with the first dose, where the immunity response starts.